Hi, welcome back to Future Fast. And before we bring Dr. Shika into the conversation, I hope you caught up with the first part of our conversation where she shares the journey. And there's a lot of talk about food and where it comes from before it hits her table, her plate. So if you have missed it, please do catch up with that conversation because the journey is what was covered there. So today and now, what we are going to talk about is going to be some things which we going to pull out of that journey and focus upon. So please do catch up with that conversation. If not immediately, after this, you can always go back because I'm sure it will motivate you to go and get her journey also. And with that, Shika, thank you so much for making time. Welcome to Future Fast once again.
Thank you. I'm ready for the ride.
Wonderful. So, Shika, one of the things, part of your portfolio living, like you put it, right? You're part of the portfolio living, and part of the significant part of your portfolio has been public health. So, of course, you spoke briefly through the course of your journey, and we jumped in a bigger hurry to the plate and what's in the plate, which was nice. But want to get back on the public health. So, how did the first of all, how did you get into the public health space? Of course, your qualification must have made it much easier, but you did start uh, your professional journey, not necessarily in the public health space, right? You started in your pharma business side.
I
Uh,
I was working into vaccine development.
so yeah,
So
so where did the public health figure in?
that's a very interesting journey. And I was working at ICGEB. So okay, even before that, so I did my postdoctorate from USA. It was in biomedical research. So then I came back to India and I joined ICGEB. There, I was doing research on finding novel vaccine candidates for malaria. So, that was a very interesting journey. But then you want to do something else. That is what has always driven me. Okay, this is perfected, doing well here. Now, what else? So, I come from there. So, because, I challenge myself. That is how I grow. Because one thing, if I have done well, I want to move from my comfort zone then. So, was developing these vaccine candidates, did very well, published 4 manuscripts. In fact, I came from US also with 2 publications, which I encashed to enter this prestigious ICGB Institute. So, things are never easy. You have to work for them. So, I've been a hard worker all my life, thanks to my upbringing, my parents, my family and support system, my in-laws, very supportive. I've been studying throughout. So after marriage, I did PG diploma in biotechnology business management. And this current lab, which was developing a malaria vaccine candidate, that was the group of Dr. Chetan Chitnis. And we were developing a first in man malaria vaccine. So, because I had done PG diploma in biotechnology business management, I became the first manager for malaria vaccines project at ICGB because ICGB, Dr. Chetan Chitnis was poised to transfer the technology from his lab to an industrial partner, which was Bharat Biotech at that time. So this was one state. I've grown within institutes. This also I should tell you. I was in ICGB for 4 years as a postdoc, and after this was after marriage. I mean, I came back from US, got married, and then did joined ICGB, did my malaria vaccine research, finding antigens for new malaria vaccine candidates. And then I did PG diploma in biotechnology business management. So, the lab was gearing up to transfer the lab technology to an industrial partner. So I was the manager here because I had a PG diploma in biotechnology business management. And then, first vaccine candidate, we did the tech transfer to the industrial partner. Another 4 years, 8 years for me in ICGB. And then I said, learned it enough. That's how somehow I see it, because now they wanted to test another malaria vaccine candidate. So I was like, I've seen the process, I've seen the entire translational development. As a microbiologist, the public health tuberculosis program was looking for somebody who could help scale up public health laboratories in the country. And at ICGB, I had helped develop immunoassay labs, which was good clinical laboratory practices and good clinical practices compliant. Right. So, Government of India program, through a partner which was providing technical assistance to Government of India program, that was PATH, they hired me to set up these laboratories or scale up these laboratories which were doing diagnosis for tuberculosis in the public health arena. So that is how I moved from academia, because ICGV were more of academia, though I was heading translational work and I was also the first manager there. But then this transition happened because I got chosen to set up tuberculosis labs in the country, which I did. We helped scaled up the Government of India. That was a teamwork, of course. No individual can do so much. In a team working with a lot of development sector partners, we had a lot of new laboratories for tuberculosis, because these were laboratories that could do tests based on molecular diagnosis. So, that's how I came in from academia to public health.
Right. See, post-COVID, the narrative and the general perception of Indian public health system is different, right? Post-COVID. Of course, there have been different, very polarized perspectives also post-COVID. But that aside, you were part of all this before COVID.
Yes.
So, what was the perception for someone like you who studied abroad and came down here? And when you said that this is what you want to be doing, what was the general perception in your ecosystem, right? I mean, people what was their perception as what it's going to be, and how was it from your own perspective when you actually started doing it?
This was something totally I could identify with, because I realized very early on we have a different perception of how government health system is laid out and how the services are provided, because we believe free is not good. Largely these services, or all the services, there's no charge for it. So we have the perception it's not good. So I was tasked to help scale up these laboratories. I was tasked to scale up new diagnostics methods, and also in assuring quality.
Was that a government of India run agency, the research institute?
So that's a Government of India health program. It was
No,
earlier.
the previous research institute you were part of?
So that was ICGB, International
ICG.
Center for Genetic Engineering and Biotechnology.
So it's
Yeah.
part of the government, or it was
That's a
supported by government?
UN-based organization, but
Okay.
funded also by Government of India, Department of Biotechnology.
Right. Okay.
So then move to this public health. This is a Government of India run program where all services are quality assured and free of cost. So, I was in the public health arena in two roles with the National Tuberculosis Elimination Program. So, I was there as a microbiologist helping scale up laboratories. And then I was also national consultant for monitoring and evaluation of this particular tuberculosis program across the country. So, that's why I can proudly say have been a foot soldier, have traveled to the length and breadth of the country, have understood issues at the ground level, have found solutions, have listened to people, how they perceive health, how they access health, because as a monitoring and evaluation person, we were also going and talking to patients. We were
Mm-hmm.
interviewing them regarding the quality of services, how they were accessing it. So we were going to the last mile to get this report, and actually we were making these formal reports also, so that
Mm-hmm.
learnings or recommendations can be adopted. So learned a lot while traveling, going and meeting and interacting with people. And public health system is beautifully laid out in the country. So
Mm-hmm.
we have sub centers, we have primary
But
health.
how was the perception generally, even in your friends who are obviously not exposed to the public health system? Because I think even today, the first thought most people get when they need health care is that some private hospital.
There are a lot of many issues to it. Let me break it down. So cleanliness, these private hospitals, they are sparkling, five-star services, they have a cafe, waiting area, air conditioned things, and and you have to pay for all these services. At the same time, in a government facility, mm, the thing is, it's crowded, overcrowded, I may say. So people don't want to lose time. So that is the perception. In addition to cleanliness, they want to spend money but save on time. That's why they go to these private health facilities. But government of India health structure, best of doctors, best of students are there in our public health network. So probably out of fear, because we actually fear that there are a lot of hospital acquired infections coming from these government hospitals because they're not clean. A lot of hue and cry about antimicrobial resistance, a lot of hue and cry about super bugs coming from these hospitals. So our perception is probably things are better, even if the layman is not going into antimicrobial resistance, because that's for a microbiologist and people who know this area. But cleanliness is the main thing that I would say. But now if I see AIMS or other large government hospitals in the country, they have made booking very organized. So now you can get a slot, prevent overcrowding. Having said that, I would want to take my family to a government system.
You would?
Yes. So the thing is, my father-in-law was having some coughing problem. I took him to a local public diagnostic center in a government hospital. So, this is the power of change you can bring within. Because I have worked with such systems. I could convince him, and he really got his diagnosis, though he did not have any ailment, but he got the x-ray there and the expert opinion. So, it's about how we perceive, it's about fear. Fear is what either drives us, or fear is what holds us back.
So, do you think this perception of our Indian public health system being bad is changing and has changed significantly?
Fear is good because we think doctors are God, but they are humans as well. So it's good to know about the doctor you're treating, who is treating you. It's good to be aware about the specialist you're seeking. I think let's not find a health giving system or services based on cleanliness or cost or saving time. Let's go and access health services regarding accountability of the specialist or the caretaker you want to access healthcare from.
Do you think that is there as much in public health system? as much as it is in the private?
You know, if I talk about people who access government services, you know why they do? Because they're closer to their homes, right? They have confidence in the doctors.
Hmm.
You know, if the doctors have time, they build a rapport with them. They open up. Because, you know, I see mohalla clinics near to my house. People go there. That service is available at their doorsteps in Delhi. People want to access these services if they are made aware that they'll get good health care there. So, you know, it's all about sensitization, it's all about awareness. And then, you know, because I have all these people coming to me. I'm a microbiologist, I'm a PhD in microbiology. They think I can read medical reports. So, you know, all the people around my locality, my vicinity, I'm always reading their medical reports. So, yes, I can. And then I can link up to doctors and specialists. I also reach out to my doctor friends. So, you know,
Maybe they come to you not only because you're a PhD, but maybe you are associated involved with public health system, right? So maybe that is what is the bigger confidence for them.
I would say it's the aura you build, that you are there, you are helpful, that
Yeah.
you are there when they need you. I have I have people who have worked at my house, the person who is cleaning my car, the person who is selling my vegetables. They call us, and their wives also. So you know they're having backaches. They want to talk to me. So I've been trained. I've had such brilliant teachers and mentors. We've been trained to find solutions. So you know, my mind is always looking for solutions. So I find solutions for them. And you know, I tell for an entrepreneur also, your success is if you get a repeat customer. So you know, my success is these people are always coming back to me. And
Uh,
sometimes it's a blessing also. So the Didi who helps at my home, she showed me her ultrasound and her reports. She was getting treated for something else, but the problem was something else. It was an add-on problem. I won't say the doctor missed it. I would say it's an add-on problem. She had a contraceptive device installed, which I could link because she was telling me, Didi, it pains when I bend. She went to the doctor because she was having some liver problem. But you know, because I was talking to her, I could relate. She's bending, she's getting the pain. It's the UTI, that copper device had moved. Because I knew her, I was familiar with her, I could tell her this is causing you problem as well. You know, she went and got it removed. You know, that is what I say. You need people to talk to. You should actually talk. You know, we are very used to having second opinion, third opinion. I think it's absolutely right. Everybody needs to be empowered, whether it's a doctor in a private facility or doctor in a government facility. We have the right to another opinion. We have the right to another diagnosis. It's our body. We have the right for everything. People are not aware. If they're not happy, they have the right to seek healthcare elsewhere.
but how does that work in a public health system where there is so much of rush, right? I mean, as such, access is so rationed, if you will, that so there
It's
is no
worth the
question
wait.
of a second.
It's worth the wait. That's what I can tell you. So, you know, if I send my family and friends, we are booking online. We don't waste our time. If my house
And
help
it
is good,
works by the
yes,
clock, whatever the time. Okay.
yes, my sister, my cousin sister, she only goes to government hospital. I take my family only to government hospitals. The doctors are good. They are my friends as well. That is secondary.
Well, what about this argument that India is short of doctors?
Oh, that is there. They always talk about bed to patient ratio. They talk about healthcare professionals to patient ratio. Yes, we are always lacking there.
So is that getting any better? Because of course in UP at least, I saw some report where UP CM was talking also about adding a
Yes.
hospital in a district, and
Yes.
I think they were talking about 200 or 300% growth in
Yes.
terms of infrastructure itself.
You know, that is very much important. You know, infrastructure is a
But
surrogate for growth.
how do you make it up when we don't have enough doctors? Or where are our doctors? If we, I mean,
Vacancies, these doctors are
India, Indian
multitasking.
doctors are there in US, Indian doctors are there in Europe, UK, everywhere. And why do we complain we don't have doctors? Then?
The thing is, I
Uh,
take this session also blame game. Blame game, it's very easy to blame others because, it shifts the responsibility from you to somebody else. If I have an issue, I have to find my solution. It's not that Mr. X is going to find a solution for me. If you need solution, you'll find it. So the thing is, if people they're complaining about where have they accessed help, how have they accessed help? God, there's so much online there. You can book consultations. You can get online from mental health to actually discussing your symptoms online. Please ask them to reach out to me. I'll connect them to doctors who are doing teleconsultations. If you're willing
so
to pay,
are you saying we have at least there's nothing to alarm about having lack of number of doctors or access to doctors?
no, the statistics speak for themselves. The ratio is skewed. We can do with more. That's why we have a lot of focus on having more medical colleges, having more government hospitals. Aims are coming up, but they need to be also equipped with manpower, equipment, and accessibility for people. People should find it convenient to reach them. Public health doesn't stand in solo. They need transportation, they need roads. So, that's why I'm saying a mohalla clinic is much better than a tertiary care. We need more of such things.
So you also traveled across India as a part of your uh, job in public health. Of course, it was through a what do you call a trust? What do you call that?
We are
Uh,
actually development sector partners
a
who are
development
supporting
sector partner.
supporting
Okay,
Government of India national programs.
right. So now, how do you see the roles of these development sector partners, these not-for-profit organizations?
Yes.
Uh, vis-a-vis, I mean, by what you're saying, that they are a very necessary partner to
Nice.
rolling
Yes.
out all these welfare schemes, right?
Yes.
So, how do you? What are the positive and negatives of these development sector partners, which you've been part of, through which you've also been associated with the government agency?
So the thing is, development sector partners bring in diverse expertise, which can, in addition to the government officials, can fill in to provide technical assistance. So,
Hmm.
so government official is looking after a different portfolio, but then these development partners, they are on the ground also and sitting at the state, because now I'm talking about health only, state health department and national health programs, they're actually posted there
Hmm.
to help advance the mandate of the government.
Hmm.
Because there's a lot of thing about international NGOs affecting the way Government of India national programs run. But what I would want to say is they're here to provide additional technical support to fulfill Government of India mandate. It's
Hmm.
good to get international learning. There's a lot of brain within the country also. So these are all partners which are brainstorming with the government to enhance the public health system.
How do you see this? Maybe a conspiracy theory or an allegation that a lot of these international agencies drive their agenda to push their countries, multinational companies, access to uh, uh, Indian patients.
So that's an interesting thing. We have seen for COVID vaccine also, no? So
Hmm.
we have read a lot in the media
No,
who
prior
pushed
to that,
what and
that's
for
prior
why.
to COVID, actually, COVID.
No, that is something which affected all of us. We all are COVID. We have learned so much during COVID. COVID was a big teacher. So I'm
Right.
just trying to say that
No, even
somebody.
now even now that has come back, right? With somebody admitting that they were not ready and the vaccine was not ready, and the Side effects they were aware of it. So
So, so if I put it in perspective, uh, we had to give people an answer to their fear because COVID was killing. So, vaccine was something which people thought would nip it in the bud. But, these were class of coronavirus. And when I did my microbiology, in a microbiology book, I'm talking about uh, 25 years ago, they got coronaviruses got clubbed in a section other microbial agents. So, there was never given any due value to them because it was as good as having a common cold and getting immunity to one strain once you've had it. So, but when this COVID started, a coronavirus group started killing, fear, people needed a solution to the fear. Vaccine was the solution. So now we all lined up to take the shots.
So, vaccine was not really to cure or address the virus problem, but to address the fear. That's what you're saying?
It was supposed to address the virus, no? But the fear
Supposed to,
was
but
killing. No, let's not go there. Let's not go
okay,
there because
okay.
no, because that is still, that the scientific community
No,
needs
that
to
is
debate.
also what is the recent news, right? Where they
Yes,
also agreed that yes, it was not effective, blah blah, whatever.
you use the word conspiracy. So conspiracy theory could be many, but where are the facts and figures? We need
No,
to have scientific evidence for everything, even starting from where the virus originated. The conspiracy starts from there. So, then what got pushed, and now why these vaccines are not, having these adverse events. So, the thing was, did we all take a conscious decision to get vaccinated? We did it out of fear, or we did it out of compulsion because we had to show the certificate to go back to jobs and
perhaps
public.
both, right? Perhaps both.
But I would say you had a choice.
No, but your work demanded it. You need to have your livelihood. You had to travel. Travel needed this. So,
So,
of course, I do know some people who are actually saying that they got a certificate. They didn't get the shots. They managed it.
conspiracy theory and rumors, huh? Yeah.
Oh, no, no, no. This part I know for a fact that there were people who actually got certificates of having taken vaccine without actually taking vaccine. So maybe they, or however, whatever means they secured it. But uh, but the the fear and the
Compulsion.
compulsion drove that for whatever reason. And today, of course, most of us who have taken, we don't know whether it was the right or the wrong thing to do, but we did it. We
Out
have
of
taken
fear,
it.
out of fear, out of compulsion. So, the thing is, that's how sometimes public health issues
So,
have
how
to
do
be handled.
you, as a microbiologist, qualified microbiologist, and formerly involved,
I've
or presently
worked,
also, are you still involved with public health work?
yes. And I was
Okay.
part of vaccine development.
Also, so how do you see this with all these three together? How do you see this?
So I had only one question. Safety data for a vaccine to be introduced in a public health environment requires at least 2 to 3 years.
But see, on that part, I have an argument, right? See, that was the time where we didn't have uh, technology evolved sufficiently uh, to test it remotely, right, online, where you could check what are the possibilities, and we had we today have technology to simulate what could happen. So that is where the argument came that okay, these technologies were employed, and that's how people could come up with vaccines.
I,
So
I'll tell you just a joke. We test these vaccines in animal models before they are giving to humans. So, while I was developing this malaria vaccine, this is not against any vaccine, but it was a joke that mice, they fear when they're injected with the vaccine. And that
okay,
fear can give any sort of results. So here, uh, these vaccine passed animal studies. They were given to humans, but as a microbiologist, as a person who have worked in vaccine development, I'm saying still safety data requires more years. This is the only thing I'm saying.
So then, how do you justify, given that argument, we could not have had any
Yes,
vaccine?
yes.
I mean,
So,
if
so,
we were
so,
to go by the book,
so that's what I'm saying. The public health required a solution because
so
people
to
wanted
address
their
the
life
fear,
back.
to address the fear.
They wanted their life back. Because we were confined, we had to go back to office. We had to get back to socialize.
So you also took vaccine, right?
You want me to say it on record?
I mean, okay, you were okay. Forget that
No,
part.
not even a single shot. I am not
What
against
about your
vaccine.
family? Did you recommend
I,
them to take?
I'll just complete for myself. I'm not against vaccines.
I know.
But
I obviously like to believe that because
I
you worked on it.
technically, I knew the safety data requires a longer time duration.
Correct.
You know what
So,
it entailed? Not taking an airplane, not going to office. I did not. I had that
what about
luxury.
your family?
So,
what were you recommending when people were reaching out to you for this, saying, "What do I do?" What was your recommendation?
so my recommendation was because if I say what I'm going to say, this is about the
I mean,
vaccine
if you don't
only.
want to say it
No,
online,
I can say. I told
okay.
them don't go for a genetic modified one, and I explained them what is what. I told them to go for a inactivated virus vaccine.
Which was that vaccine in
So
India
let's not go
context?
there. If people know, they know what I'm talking. So because there's still a lot of controversies, I told them don't go for the genetically modified ones. That is what I want to say. And another question I asked, these vaccines were told to give protection for 3 months. Do you think you are at risk in the next 3 months? These are the two things because everybody discussed with me.
Hmm.
And I told them to follow two people who
Okay,
were
who are
being
those two people?
who were
Okay,
being vocal about it.
okay, who are those two people? I mean, of course, it's way too late, but just for curiosity.
That boat has sailed.
Sorry?
That boat
Of
has
course, the
sailed.
boat has sailed, so it's okay. It's of no consequence, but just out of curiosity.
Uh, let's not go there because I would be selective there and saying others are not right. But this was the family advice. I
Okay.
told them to follow these two people what they're saying about the vaccines.
Hmm.
And if you think you are at risk in the next 3 months, go get vaccinated.
No, okay. Are those two people Indians you're referring to, or outside
I'm
of?
talking about Indians only. Though
Okay,
at that time I was following a lot of groups which were against the vaccine.
right.
So it's also like there are people, there are certain doctors, not in our country but abroad, who say vaccines are toxins. But there are vaccine preventable diseases. Like
Correct.
in childhood, a young baby who doesn't have a developed immune system needs these life-saving vaccines. So these are vaccine preventable diseases, which we take these shots at birth.
Hmm.
They're a must. So it's all sort of it. The internet throws so much at you that you need to filter and pick out what is relevant or read more about it. I'm saying you have the choice always. I mean, I was very clear. If something is injected in my body, I want to read about it, like the vaccine in this case.
Hmm.
My formal training told me safety requires more years of data. That was it. But then family wanted it. They want to go back to socialize, go back to meeting, interacting. There were weddings which have been on hold. So people did. They got vaccinated. So then I
Okay.
told them which
Okay.
vaccine to take.
That was at a personal level. So, if you were to be working within the public health system, you were kind of you were working with them from outside. So, if you were inside, what could have been your stand? Would it have changed, or would it still be same?
So the thing is, I would have, or what the government already did, there was more emphasis on prevention.
Hmm.
There were more emphasis on hand hygiene.
Hmm.
As a public health personnel, I would have done that. Because prevention is the key. Like I want to be careful with
There
what I
was a lot of
eat.
talk about it, right? There was a lot of noise on that.
Yes.
Continue.
Wear your mask properly, wash your hands, don't touch public spaces. So, I've been doing it for life. This is what we do. We
Mm.
maintain very good hand hygiene. I'll tell you a very interesting bit. I've trained my child also like that. So when he goes to a get together, only he and I go to the washroom to wash hands. Still, believe me, people forget very soon.
Mm.
Hand hygiene in daily life is also important. As a public health person, I will give stress, which many did, on prevention strategies. Because COVID is going to stay in some form of the other, but there are government health programs which all like tuberculosis. It spreads through air. So, we talk about all these cough etiquettes, how not to spit in open places. So, these are all part of government endeavors. A lot of money goes into IC campaigns, making campaigns for people in local languages.
Mm. Mm.
So knowledge is power. We need to go out, read, and gather information about what affects us. That is the key. We discuss politics, we discuss these elections so much. So, it's prudent to read more about vaccines. It's prudent to know about safety, pros, cons. At least us in cities, we had access to all information. And then make a well-read choice. That is what is important.
But again, there was so much of information, right? There was an overload of information, and then
Okay.
there is mandatory rule enforcing certain things that if you've not done it, then you're in trouble.
So I guess talk to experts. I reached out to doctor friends also and I asked them.
Hmm.
So, you need to get your information from authentic sources also. Like I'll tell you very, very quickly, we ask entrepreneurs also, if they have a product, have they done a customer survey? Do the
Hmm.
customers really need your product? Because we think our baby is best.
Well, the influence of Steve Jobs is so much that many a times, and it is also proven right, that customer does not necessarily know what is good for himself. So, I mean, that has been the approach of the government. Government thinks the citizens don't know what is good for them.
We have stopped reading. We think what the other is doing is best for me. So follow the herd and be safe, or make your own road. So that's also a choice.
Yeah, true. That's true. So now, in your perspective, uh, one within India, since you've also traveled and had a interaction and experience and looking at closely across all public health systems, which states are doing good or approaching it right?
So lots of states are doing good. Literacy is a common factor because how public seek health seeking behavior is about how literate or how aware they are or how the government health programs have reached them. So, when we talk about health system in the country, so it's about a good governance, literate people. Kerala does very good.
Mm-hmm.
There are other states also which are doing good. Northeast is coming up in a big way. So, because I've worked.
Or maybe since you say a lot of them are doing good, do you want to raise flags on those who are not doing good, or those
So,
who perhaps need to be doing good
so
better?
there are certain states in the country which can really do well.
Yeah,
They need to strengthen their public health network.
you want to Call
Yes.
out what was the states?
Doctors need to be present. People need to be aware they're open. So, one of our thing was to display the time the health system, the public health system is open. That's also a quality parameter. Have they displayed the OPD timings?
Okay.
So, the thing is, sometimes the people visit. They sometimes visit at their convenience. By the
People
time the
visit.
OPD has shut.
Ah.
So, multifactorial aspects, how health is sought in the country.
Mm.
So, there are certain states which can do better. They need to talk about, they do
Which are
talk
those
about,
states?
sorry.
Which are those states who
See,
need to do better?
I have worked largely in the tuberculosis and HIV/AIDS program. So I can speak about those as those only I would want to say, because this I have seen very closely.
Mm.
So Government of India also have the TB programs also have these national certification for people there for states which are doing well. So
Mm-hmm.
the good ones are many, and
Mm.
this system brings in a competition that if other is getting recognized, we also have to push the bar.
Right.
So everybody is looking up, and now government health programs are more focused on grassroots level interventions.
Mm.
So in the healthcare ambit, the gram panchayats or the
Mm-hmm.
village is the smallest entity
Mm.
to
Mm.
give good healthcare, to give good awareness
Mm.
in the native language. So Government of India and the TB program also has awards for these panchayats.
Mm. Mm.
So if you read the news, everybody is coming up. They have made the indicators very simple.
Mm-hmm.
So a lot of change I've seen from days I was actively on the field to the changes which have happened now. And India also has a TB elimination plan 2025. So government is also aggressively working for it. States are, it's as good as how the push is given.
Mm-hmm.
People think for tuberculosis, it's a rich man's disease, but
Mm.
TB does not discriminate. So, the thing is how percolated we are in the health system. The state or the district or the village has done that job well is coming up. That's my message to them.
So
The
you don't want to name the state, is it?
It doesn't help because they all are
Okay.
improving.
Oh,
They all
okay.
need to improve. The push is to eliminate TB.
Mm.
So they all
Mm.
have to come up. The bar has been raised a lot. So
Mm.
that's why I'm telling you, there are a lot of capacity building, there are a lot of trainings, though there's a lot of multitasking
So if
happening.
you okay, maybe if you have to look at it as what makes a most successful state to a state which is needs a lot of things to change to get to that. One you said is education,
Yes.
and what is
And
apart from that?
holistic approaches to health.
What does that mean?
There are also a lot of social determinants to health.
Such as
We something like we cannot solve a housing problem. We cannot give everybody clean drinking water. So,
mm,
it's
mm,
not
mm,
one ministry. If tuberculosis program is trying to solve a health problem, other government departments need to work synergistically. Where the synergy is good, there is a term called
a bit.
intersectorial collaboration happening.
Okay.
Those states are doing good.
Okay.
It's a
Okay.
multi-level dialogue, brainstorming, frequent meetings, and taking actions on those recommendations. Because, always say if you have minuted minutes, if you have not put timelines and if you have not put responsibilities, it does not help.
Mm.
Accountable healthcare is the future fast need. People in the health system
And
have to be made.
you see that is happening.
Yes, the changes
And is
happen.
it something because of COVID that drove a lot of this, or is it
Yes.
something you see independent of it?
No, it is because of COVID. COVID has been a biggest teacher. People are more aware of their health needs. I heard the Didi in my home also telling me people having adverse events due to COVID vaccine. So, media had a lot of thing in it. Now, We, for a time, developed the habit to read and to discuss. I think we have lost that again because public memory is very short. So, I come back to that only. Government is putting a lot of money into capacity building. The government officials are getting a lot of trainings. At the same time, it has to work both way. Health seeker and health giver. So, there's a concept called salutogenesis also. Because my mentor trained me so, salutogenesis is the future fast need. Salutogenesis
And what's
is,
that?
yes, I'm coming to it. It's not about when the disease has already happened. Salutogenesis is looking at the aspects which lead to development of a disease. That is about the physical, social, and biological determinants of a person. So, how his physique is, how well nourished he is, access to education, access to health facilities. So, that is the salutogenesis approach. That is, you're not just treating the disease after the disease has manifested. So, normally we go and seek healthcare after we got something. If you see a lot of people who have
So
heart ailments,
are you leaning towards this celebration of this yoga day and things like that?
I perfectly agree. Lifestyle change. You don't have to wait for a heart attack to happen. Healthy living and yoga, the government is promoting in a big way. Healthy lifestyle, healthy eating, conscious eating, living in the present, de-stressing,
So, but
giving value
do
to mental
you
health.
see from your work that it is actually happening across each of these? Because the touch points are so many departments, right? One is the agriculture department, and then that food and food processing and all that, then supply chain, infrastructure, certification agencies. Uh, so, all of them are aligning because if this needs to be achieved, everybody has to be aligned, right?
How can they be aligned? Did somebody did a conscious effort to align them? Everything works in silos. So the future fast needs
Then how will
synergies.
it improve? How do you say then it is improving? Because if you see that none of them are aligned,
I
how is
see
it
it
improving?
at the smallest governance unit in a village. The thing is sustainable development goals, and Government of India has that for as localization of sustainable development goals for villages. That's a
Hmm.
Niti Aayog's mandate.
Okay.
So it is starting in a very big way. So, this is also important that better health, better education, better infrastructure, gender equality, work inclusivity, all these things happen. And,
Yeah, in pockets it's right. Okay, those
yes,
public defecation is addressed with toilets,
open defecation
and
free,
open
yes.
defecation is, and you have gas cylinders, which is addressed. That coal-based cooking is
Ujjwala
addressed.
gas scheme, yes.
Ujjwala. So individual isolated effects are contributing to the collective effort in even if it is in silos in that effect.
Yes, yes,
But do you see the uh, uh, this is appreciating to the value derived out of public health work?
yes. The
It is.
future is very good. The younger generation, no?
But
If we,
do you see these efforts that are happening at least at a government of India level? Are they do they have that kind of a broader vision, and that's why these things have been attacked? Or is it just a populist effort, but somehow it is still collaborating and contributing? From a public health worker point of view, do you see that there seems to be some kind of a organized effort happening? I'm just thinking when if each of these efforts are is there some method to this whole thing, or it's just a madness falling into a systemic method?
no. It's entropy is there, but it's getting aligned. So there's structure to this madness.
There
So
is so there
yes,
was this vision, a broad vision, which drove
yes,
for okay. Okay,
Yes. So like India has a net zero target for 2070. We are working now.
but do you think the system which makes it happen, right, at a public health works and each of those things are all in sync and they can operate independent of the politics of the country?
See, the
because see, I'm asking this
politicians.
because recent elections we had, right, and there were many political parties who wanted to change many of the policies and all that. So do you think a change in a political dispensation can change these things also at a public health systems needs and processes that are kind of
I'll,
falling in place?
I'll tell you a very interesting thing.
Mhm.
Government of India is bringing deep tech in a big way now. How many of us are aware the policy is on the website for people to comment? When we are given the chance, do we make a difference? This is what I'm telling you. The government is investing a lot of money in infrastructure, a lot of money in research and development, a lot of money to ensure services reach the last mile. And when they put this policy documents on their website, are we going and seeing them? Are we going, because taxpayers' money is going there. Have we asked? It's always about what the country is doing, what the government system is doing, what the healthcare is doing, what the politician is doing. My question is what we are doing as
No, but
citizens.
sometimes, see, okay, at a personal level, I'll tell you that sometimes some of the constituents of those policy making body, right, whom they have invited and all, some of those things doesn't give you confidence at all. That okay, if these people are part of this effort, then it doesn't give me confidence.
Believe
So
me,
I don't even think of looking into the policy document. What's the point?
people do
So,
raise voices.
is it?
I've seen these documents when they are in the open forum, people do comment.
So as a public, no, but are they considered and
So,
to the point of changing the document?
so there are experts among us who are valued in our own field. They're also called to these brainstorming sessions because during the G20 summit, I have attended
I
few of
remember
these.
I was also I remember there were a lot of those things. People went, took selfies, pictures. But what I want to know is all these consultations contribute to some constructive
Yes,
outcome.
yes, it all adds up.
Okay, they do.
Probably it may not show instantly, but if you're supporting the government to bring out with a policy that affects you, your life, so be the change you want to be, you want to see.
No, no,
I
but I just want to
we
see
are
that
we are
okay,
more
it actually adds
conscious.
up. Okay, because I thought it was more a show and tell
No,
than
no, no, no,
act.
no, no, no. All these
No,
experts
okay.
were called and people were giving the platform. It was so beautiful. I witnessed it myself. So are
Hmm.
we going to such meetings? Are we asking to be invited here? These are the things. If I come across something which interests me and it's happening around me, I ask for an invite. This I've done it always. So go out, see what is happening, go what the government wants to bring out. That is also future fast action for all of us. How conscious we all are to what we need. It's very easy to shift the blame. But did we make a did we contribute for a change? Otherwise, we can just sit and crib. Very, very easy. We can sit and crib from the comfort of our homes. Very easy. With food on our plate, it's very easy. But if you have to build a nation, you have to build what affects you locally. I'm not saying to be an activist, but at least go and get heard, show up, brainstorm.
So just to conclude, so are you confident that we have a whole ecosystem in India? We have an ecosystem where there is a public participation. There is a machinery, the government machinery of functionaries starting headed with bureaucrats to the ground level workers, and there are participation of sorry, I'm not getting the term. What do you call that? NGO as
Development sector partners?
development sector participation,
Yes.
and collectively they're all well placed to run, no matter what kind of a political uh, disposition that comes in. These three things are very well placed to run, irrespective of the kind of oil. I mean, if politics is the oil, kind of oil
Yes.
that comes into this engine, they're well placed to run and
Yes.
go better. Okay.
Yes, because now add this thing about, I'm sure you would have heard ESG is the big word. Social stock exchange is the big word these days. I was just curious. I went with the curiosity, can my NGO be listed on social stock exchange? So I got to know about this webinar, this event which National Stock Exchange was holding. I saw to it that I got an invite. I attended, even spoke to lawyers, got real clarity about where I stand, what I need to do. I have my roadmap. It's like I have to get up, show up, find what affects me, find what I need. Nothing. I in my motivational speak for fundraising, I tell them, you will never get funding because it will never be announced. You are the 11th speaker on the show, the lucky 11th one. You are getting this funding. It never happens. And I also end with saying, Rome was not built in a day. Small, consistent efforts over time are essential.
Wonderful. Thank you so much. And to the audience and listeners, there are links to follow Shika and the kind of work she is doing. So please do follow. And I'm sure you would not be disappointed. And also, you know why you should follow, because you just heard her. So, and also please do share this podcast to with people in your network who you think will benefit, who's you heard again why, and you know who would benefit out of this. And once again, come back, because we're going to get Shika to talk about her perspective on future, and also get her to make some predictions. Uh, I mean, time will be the one to tell how good, how right or wrong. But most important thing is, it's not about how right or wrong. It's more about how much of we fall into the right of it. So,
Yes.
so thank you once again, Anshika. Thank you
Thank
so
you.
much. Wonderful, wonderful conversation. Thank you.
Thank you for having me here.